Hi all, today we can discuss some essential tips for OET writing. First one. Use the reading time accordingly. At the beginning of the OET writing subtest, you will be given 5 minutes as reading time. Use it wisely and go through the task instructions, paying attention to essential details. In there, you should find out to whom you are writing and why. Based on this information, it will be easier to select the case notes that are relevant to the reader. Second one. Organize the case notes in a structured manner. The most important thing to remember is that case notes should be organized in neat paragraphs. This will help you achieve a clear structure for the letter, with all relevant information being included. Your letter should follow this structure: introductory sentence, main and secondary issue, any other details, and a request. The issues can be medical or social. Additional details can refer to medication, and the request should be clearly mentioned in the final paragraph. Third one. Include the main medical issue, diagnosis/surgery, and purpose in the introductory sentence. The introductory sentence should refer to the obvious medical issue, which can be taken from the admission diagnosis section. Based on the problem, you should refer the patient to a specialist physician for examination. You can then proceed to describe the issues more in detail. For example, the main medical issue followed by the secondary issue. Fourth one. Distinguish between main and secondary issues. It is important not to confuse the main issue with the secondary one. For example, if a patient suffers from headaches and dizziness, you have to determine which one follows the other. The main and secondary issues should be described in separate paragraphs. Please remember, mixing ideas in the same paragraph can result in a lower grade. Fifth one. Understand the task. Read the writing task as many times as you can, with attention, so that you make sure you have understood what you have to do. The better you understand the task, the bigger your chance of successfully completing the letter. Sixth one. Write a separate paragraph for any other details. After you have written the main and secondary issue paragraphs, be sure to write a separate one for any other details if you have. Seventh one. Even though you have mentioned the need for referral in the introductory sentence, it is not enough. At the end of the letter, you will have to be more explicit and state the request for referral. Use the information from the OET writing task instructions, as well as from the discharge or management plan, to describe the request in a well-structured manner. Eighth one. Your letter should tell a story to the reader. After you have selected and organized your case notes, it is time to transform them into the actual letter. You should write the letter in a manner that it tells a story to the reader. Do not copy the case notes directly, as this is not recommended. Please remember, not all the information included in the case notes is useful. Some details are placed in there to distract you. So include relevant information in your OET letter. Hope you all understood. Thank you all.